Hello, everyone, and welcome back to the Mindbody Medicine for Chronic Pain podcast. I am your host, Sean Hershey, and I am so glad you are here, thrilled to be talking with you today. So, today is the last day of August, August 31st. Here we are. We are just about to hit Labor Day. And so summer's winding down. I'm like, I feel like one of those typical basic people who's like, where has the time gone? But truly, I'm like, where has the time gone? It's already almost September. That's truly shocking. But yeah, here we are. Summer's winding down. It's time for the kids to go back to school. Things are getting more serious. It's time to get serious. And this is actually a really good time. The reason I'm talking about this is because this is a good time to get serious about your healing. The kids are going to school and you are going to therapy. Right? And like, obviously, I'm joking, but like, but you truly, like, this is a really good time of year to evaluate if you're not where you want to be in your healing. If you're feeling frustrated, if you're feeling alone, if you're feeling stuck, or you're feeling scared this won't work for you, or you're feeling hopeless, like if you're feeling, you can't go any deeper, you don't know where to go next, if you're like, just trying to do this all on your own and you can't do this by yourself anymore. Yes. Yes, 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 and yes to all of the above. I am here to help you if any of those things are true for you. TMS therapy will definitely help you take a huge next step towards getting out of chronic pain, chronic symptoms, and chronic conditions. And I would love to work together. I would love to be with you on that path. So just so you know, you can very easily schedule a free consultation with me through my website. And my website, it's mindbodymedicineforchronicpain.com or seanhershey.com. Both will take you right there. Okay. Let me say this before I introduce our awesome guest for today. If you're following along closely and paying close attention, you will see that I changed the picture of myself for the podcast cover to a new picture. And this is because I showed it to one of my friends and I was like, look, I started a podcast. And this friend, she was like, oh, love the cute baby face. Which I was actually really happy for that feedback because I was like, I don't want to look baby face. I want to look like adult. I am 37 years old now. I just had my birthday and I'm like, I do not want to be giving child. I want to be giving adult. So the old photo was like from a professional photo shoot that my friend did with me, which was awesome. The new photo is literally a selfie, but I'm like, hey, I look older in it. So that's what matters. So a new photo for you to enjoy. Hopefully it's not too much of a shock that the rebrand. But I just wanted to make that clear in case anybody's paying attention to that. And then the coolest thing today, we have a really great guest. Her name is Katie Estridge. She is many things, many titles. The oldest of which is a physical therapist. And she does a great job of bringing the physical body into this work, bridging the physical and the emotional and psychological. She does a really beautiful job talking us through that. So I cannot wait for you to hear this interview. She has not only does she, she practices as a physical therapist, but she has a really cool story about, the terrible symptoms she had and all the pressure she put on herself. And like, man, there's a lot to learn from Katie. So without further ado, I hope you enjoy. Hello, everyone, and welcome back to the Mindbody Medicine for Chronic Pain podcast. I am here today with Katie Estridge. Hi, Katie.
Hi.
So glad you're here. By way of introduction, I want to let everybody know Katie is a physical therapist, a professional yoga therapist, a pain coach, a meditation teacher, and founder of Queen City PYT. So that's a lot. Can't wait to unpack all of that. So excited to have your expertise on the podcast today, and welcome.
Oh, well, thank you. Yeah, I'm excited to be here. I've really, really loved your podcast. I think I've listened to almost every episode. It's been really good.
I appreciate that. I really do appreciate that. Thank you.
Um,
Okay, well, yeah. So let's start with that. Like, why don't you introduce yourself? Tell us who you are, what you do professionally. Certainly if you want to include anything personal, that's cool too.
yeah.
But yeah, let's start with that.
So I've been a PT for over 20 years, and I formed my practice about 10 years ago as an integrative physical therapist, sort of starting to incorporate the mind body into my practice. Um, and I recently moved from Charlotte, North Carolina to Columbia, South Carolina this summer. I have two boys, two teenage boys, wonderful husband, and I'm actually also an artist, and I've started doing more art recently. So that's been fun.
I did not know that.
Yeah,
That's what's your medium when it
oil,
comes to art?
oils, landscapes. Yeah,
Wow.
like marsh.
Oh my god.
So
That's lovely.
that's really feeds my soul. And so lately, I've been trying to create more time for that, which is against my nature because I'm a caregiver and I'm a people pleaser, and the art thing is just sort of for me, and I love it. So
We're already so on topic.
yeah,
Negating the self in order to please others. You're in the right space, Katie.
yep, yep. I'm pretty much fit the mold for the
But
mind body, you know, practitioner and for the mind body sufferer of pain.
same, same. And most people listening are too.
Yeah,
So we're all in this one
yeah,
together. But yeah, so why don't you tell us about, I mean, you are similar. At least it sounds like you're similar to me in that you were a caring professional before finding this work. Is that right?
yes, yes, yeah. I was,
Okay, like in the helping professions.
yeah, yeah. I've been a PT
Go ahead.
for 20 years and or over 20 years, and only discovered this work. It all blends together, but I feel like it was maybe 8 years ago, 7 or 8 years ago.
Yeah, yeah. Like, why don't we get into that?
Yeah,
Like, talk to us about like your professional journey. Starting with becoming a physical therapist
yeah,
and learning about the body, not and not through this lens,
yeah,
and how it has flown from there.
yeah. So my professional and my chronic pain journey sort of dovetail. So I'll just start with everything. Does that work?
Great. Let's do everything.
Yeah.
Let's do it all.
So it's in college. I well, even before college, I've always been sort of type A, perfectionist, people pleaser, pushing myself really hard. Um, just wanting to be the best person I can be, and you know, typical personality. So um I found myself putting a lot of pressure on myself in college, and I got mono um, summer after my junior year, and it took me down. I mean, I was down for the count. Like I'd walk into the grocery store and I'd be winded. I mean, I went from being an athlete to that, so it was a lot. It was bad. And so
Wow.
my mom, very well-meaning, took me to just about every specialist you could see. The GI doctor, many neurologists, pulmonologists. I mean, just everyone you could see. And so everyone I went to gave me a diagnosis. And so I'm this
Of course.
young, healthy, woman who was pretty strong before this, and then all of a sudden I'm sickly, you know? Um, I mean, they said I had IBS, they said I had chronic fatigue syndrome, fibromyalgia, chronic migraines, and that's when the migraines really started, is after the recovery from mono. And so, um, I did go back and finish my senior year, but honestly, the only way that I was able to work on my, endurance enough was to discover yoga. So I did like Rodney Yee's AM and PM yoga, 20 minutes, just really gentle breathing. And honestly, I think the thing that worked for me was just calming my nervous system down because I'd just been through so much, you know, medical trauma, really. Like it was
Yeah.
and it was
Yes.
what my mom came from, a place of like complete love and just wanting to do the best for me. And my parents are
Of course.
really wonderful, but
Hmm.
um it sort of created this dynamic in my head. So I went back.
Totally, and let me just butt in to say, yeah, I mean, the idea that, like, I bet the doctors were trying their best too, and, like, when people don't know the connection between mind and body, like, the amount of damage that can be done by now here you are believing, like, you have all these diagnoses, and I mean, you really did have them, like, you had all these symptoms.
Yeah.
So, yeah, my heart goes out to you in that space because I know the feeling, but yeah, go on.
Yeah, it was tough. It was a tough time. But so I went back, I finished my senior year, and I had considered going to med school, but I thought, you know, I can't work that much. Like I can't be work. I was delicate. Like I needed a ton of sleep. I was recovering from this. And so I went to PT school after college. And that was great. Thought I wanted to specialize in pediatrics. Turned out I didn't once I had my clinical, but um
Live and learn,
yeah,
you know?
live and learn. So then I got
Wait, and hold on, I just can't help but butt in and say one more thing. I mean, I've worked in a lot of medical settings as a social worker. Being a doctor, I almost think, like, everyone is a little too delicate to be a doctor the way that, like, the medical profession is set up. It is bad, and then these statistics about how many doctors and medical students are suicidal.
oh,
It's like our medical system drives people to the brink,
yes.
and I'm just glad to hear that you didn't put yourself in
Yes,
that.
yes. I mean, I heard horror stories about residents, working just for days and days at a time, and I was like, "I can't I will die, like, I can't do that."
Yeah,
And I know it's gotten
it's so unhealthy.
yeah, yeah, I
Yes,
think
I mean, it just kills me, like, it is literally a doctor, like, you're working in hospitals, health clinics, doctors, and it is so unhealthy, it's unreal,
so
but
ironic,
go on.
so ironic, and when I did work at the
Right,
hospital, I mean, it was extremely hard to call out to be sick, which is really ironic because 'cause you're around sick people all day, so you're gonna get sick, but they would, like, really penalize you to be sick, you know? That's another subject.
right. Right, and yeah, totally, but an important one anyway. But yeah, so you go to PT school.
Yeah, went to PT school, I'm still getting migraines, they would usually typically hormonal, but sometimes I remember when I started my first job right after, PT school, I had a migraine that whole month, like, the first month of working. I just every day, just lived with a migraine, and, it would start, around the time of my period, but then it would sometimes continue for 2 weeks, depending on my level of stress. So, that basically continued for many years. I got married,
Yeah.
just I just lived with it. I just worked around it, and
Mhm.
I tried everything you can possibly try. I saw other physical therapists. I don't even know how many neurologists I saw, headache specialists.
Wow.
I tried every class of
Yeah,
medicine. I tried every preventative medicine, every treatment medicine. I tried
yeah.
biofeedback therapy, acupuncture. I even got like one of those piercings in your ear, like a Dave piercing or something to make the to. Of course, that didn't work. Like what, you know,
Right,
all these.
right. I'm like, "That's one I've never heard of," but yeah, you've tried it
I mean,
all.
I was desperate. That just tells you how desperate I was. Um,
Yeah.
so
Yeah.
and then people would say, "Well, once you get pregnant, you're gonna not have migraines anymore because your hormones are gonna change." So, I got pregnant thinking, "Oh, yay, this is my time." Yeah, no, it was not my time.
Finally, yeah.
Super sick. I had hyperemesis gravidarum. Migraines, of course, were still there, and then everyone said, "Well, once you start breastfeeding, your hormones will change, and then you'll get rid of your migraines." Never happened. Um, so
God.
I was
Wow.
kind of at the end of my rope when I discovered this work, and I'd been a PT for many years in many different settings, treated tons of different people, and it was all good. Um, but then I was at a point where my last
Well, that's something that I do wanna make a point there. Yeah, I think that's important. Like, as a social worker and therapist before I knew about this stuff, I think I did pretty good work with a lot of people.
yeah.
I was very much missing some of key stuff that I know now, but, like, people do good work without this. But yeah, go ahead.
Yeah, absolutely. Yeah, this work is the missing puzzle piece that I needed, and so once I learned it for myself, then I couldn't not do it with my patients. Um,
Understood.
but into all this journey, I started my business, and it was integrative, and I thought, well, I did all the integrative stuff too, and I was meditating every day, and I was journaling, I was doing all the things, but I wasn't making the connection between my stress level and my pain. It was just
Yeah.
happening to me. I had no control over it, um,
Yeah.
or I thought I had no control over it.
Right. 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 Right.
But, I remember and I also minimized it in my head because I remember at one point I went to a functional medicine doctor and she wanted me to journal about it, which is actually, like, the worst thing you could do because then you're focusing on it and you're, like,
Right.
about it. But I remember telling her, "Yeah, I have migraines, like, once a month, and I just feel like I need to get rid of them." And so she said, Write down how many you have." I was having headaches every day, Sean. No idea.
Oh my
I
god.
had no
Yeah.
idea I had headaches every
Yeah. Right, right. No, no, I totally relate to that. I am in a similar fashion. I like my IBS was really bad when it was really bad, and I mean, everybody is affected differently by TMS and mind body stuff. I was never out of work. I mean, there were so many things I didn't do,
Yeah.
but I was never like I missed out on so much of life in my 20s because I was sick,
Yeah.
but, like, I always put the pressure on myself to keep working, and I'm just like, "Wow." Similarly, my symptoms are probably way worse than I
Yeah.
thought they were at the time. So that's one thing. The other thing is, the journaling. I mean, I think it's so interesting how, like, journaling can be such a key part of recovery when you're doing it from a psychological lens.
Yeah.
But if you're journaling about how bad your headaches are, yeah, that's not gonna
Yeah.
help.
Yeah, yeah, absolutely. It was a good intention,
Right, right.
but one of so I made a ton of dietary changes, which I know you can relate to. Um,
Yes.
Cut out gluten and dairy for years, did all the testing, the anti-inflammatory, got different diets, and things would sometimes work, for, like, 2 weeks or something. Like, I remember
Uh-huh.
I got Botox. I didn't wanna get Botox, and I thought I was at the end of my rope when I got Botox, and I thought it worked
Wow.
for 2 weeks. Like, I felt really, really good for 2 weeks. I was like, "I will never move my face again. I'm gonna get Botox. I don't care." I was like, "Whatever I have
Yeah,
to not get migraines." But
yeah.
then when Botox failed, that's actually about when I discovered Curable. A friend had sent me, it was an article that sort of went viral about Curable, and I can't remember what it was in, but, she'd sent it to me, and I thought, you know, I already meditate, I already journal, what good is this gonna do for me? Um,
Right.
but typically with my migraines, when I would have a really bad one, I would go get a massage, and then it would be enough to calm my nervous system down to where I felt better after the massage. So I would end up getting a massage, like, once a month, and I had a really bad period where it was really hard to get through these migraines, and I remember getting a massage. I thought, "I'm gonna go to a spa so I can really calm my nervous system down. I'm just gonna chill all day at the spa. Brett, you watch the kids, I'm gone."
Mm,
And,
nice.
um, I got the massage, I came out of the massage, and my head was still pounding. I was like, "What am I gonna do?" And so I had,
Yeah.
my phone at the time, opened up Curable, downloaded it, started it that day, and, sitting
Mhm,
out by the pool. And was extremely skeptical. I'm like, "This is never gonna
mhm,
work." I'm a physical therapist. It's very rooted in the physical.
mm,
This is happening to me,
mhm.
you know, um, and within a
Yep.
month, my headaches were a lot better. It was wild. It was wild.
Mhm,
Right.
mhm.
Mhm.
That's so beautiful to hear, and, like, let's sit with that for just a minute, um, because I totally hear what you're saying. You're like, "I already journal, I already meditate,
Uh,
I'm completely skeptical of this," and within a month, it was working. Why do you think? Like, you know what I mean?
you know, I had never made the connection between the trauma that I had been through earlier in my life and my headaches. I never thought that that could ever
Yeah,
be related. And, I lost my
yeah.
sister when I was almost 8 years old,
Oh, I'm sorry to hear that.
and I also lost my dad almost 15 years ago, so grief has been really tied to my headaches. Well,
Yeah.
emotions, I also never made the connection between my personality and my pain,
Mhm,
those
mhm,
keys. I I just never thought I had any control over things. So once it was at
mhm.
about a month before I finally started journaling because I was like, there's no way journaling is gonna help anything, and then once I got it out, it was a
Right.
letter to my seven-year-old self, and I had a seven-year-old at the time,
Oh, wow.
and so I was
Oh,
able
wow.
yeah, so that was a huge turning point because I was able to think about if my seven-year-old went through what I went through at 7, wow, that's really hard.
Yeah.
I'd never, ever,
Right.
ever had an ounce of self-compassion for what I went through. I just
Mhm.
it's not
Yeah.
nature, you know?
Wow.
And so I
Right.
were just
Right.
bawling and just being like, "Wow, could this all be related? This is wild." I was
Yeah.
so bewildered
Mhm.
of it. So I think that that was a huge turning point for me, and then acknowledging that so I also I'm tend to be an emotional person. I can cry at the drop of a hat,
Mm,
not stoic.
mm,
But I always thought my emotions I never really accepted my emotions, so I always sort of thought they were bad, and I don't know why,
mhm,
never told me that, but
mhm,
I never just sort of sat with grief. I just kept thinking,
mhm.
I shouldn't be crying," and I would just cry, but I never just said, "It's okay to be sad," you know?
Yeah.
"It's
Right.
okay to be over."
Right. Yeah, I mean, that's huge.
Yeah.
Huge, huge. What I'm hearing is 2 different things there. First of all, I mean, the way that you describe this, I think is so beautiful, like, radically tuning into yourself,
Yeah.
thinking about, like, what did I feel when I was 7 years old? What would that be like if my child experienced that? Like, radically tuning into yourself and, like, allowing yourself to, like, just take care of yourself and have those emotions. I mean, it's just, like, the way you described it is really powerful. And then the second thing I'm hearing is, like, isn't that interesting? Like, because I'm the same way where I'm like, I actually do think of myself as kind of stoic in, like, a weird way, but I'm like, I've always been, like, emotional, but, like, that doesn't mean I liked my emotions, nor did I accept them. They just were there, and I fought against them a lot. It's so different to be like, "How do I fix my emotions?" versus like, "Let me just feel my emotions." It's a totally different mindset.
Exactly, exactly. Yeah, I was always trying to fix things. That was who I was. I was a fixer,
Yeah.
and
If I could fix everything, my life would be so awesome, you have no idea. I bet yours would be the same.
absolutely. Yeah,
But yeah, yeah, so okay, so you have the first month or so
yeah.
where this really makes a shift. So yeah, yeah, like, go from there. That
Yeah, so I just really got into the work. I mean, I listened to podcasts. I just sort of made it my job outside of my job to educate myself on this stuff.
Mhm, right.
And it's
Yeah,
still a work in progress, just like you. No one's perfect. I'm
same.
still constantly doing the work,
Mhm.
but I feel about, you know, 7 million times better than than back then. Just 'cause I'm
Right.
hurting all the time. I mean, it's just such a difference when you're not in pain all the time, you know?
Totally, totally,
So
totally. And as stay let's drill down on that a little more because I think that some people hear this kind of stuff and they're like, "Oh," the chronic pain brain is like, "Wow." Like, both Katie and Sean still have symptoms sometimes.
yeah.
I guess they just handle it differently or they think about it differently. But like, I hear what you're saying that you're like, my pain is better. So, like, for the audience's sake, paint that picture for us.
So, like, what it looks like with my pain day to day kinda thing?
And just how much you've improved
Yeah.
also, you know what I mean? So from the low
So,
points.
I've realized as a woman, during the time before my period, I'm more dysregulated. My my hormones are dysregulated, my nervous system is just dysregulated. So, I need to be extra caring with myself at that time. Um, like, if I'm on vacation at the time, I won't get a headache, I'm fine. But if I'm in the day to day
Mhm.
and it's that time, I will.
Mhm.
And it's never a
Yeah.
migraine, which is awesome. It's just, like, an annoying it usually starts kind of in my neck, like, upper neck, lower skull, right there at C1, and I can usually feel it sort of on the right side, and I'll notice, I'll turn my head, I'll be like, "Oh, yeah. Oh, that's pretty tight." And I'll think,
Mhm.
"Okay, what do I need to do to check in with myself?" Um,
Mhm.
and sometimes it happens even, like, not that time of the month, like, last night, I was I was taking, I ended up having to make 2 different dinners for kids and everyone, and I was taking, one to baseball and picking him up and doing all these different things, and I thought, "I'm a little overwhelmed." And then I felt my headache, and I just kinda sat with the overwhelm. I decided to not, take care of the stuff I need to take care of, just lay in bed, relax, check in with myself, and I feel completely fine today. And I went to bed earlier than normal, but I just needed that sort of extra self-care. So that's how I
Mhm.
manage it from day to day now.
That's so wonderful. I mean, I think it's just so inspiring to people to hear, like, you are actually doing so much better. And not only are you way better physically, you, like, know how to take care of yourself now, which honestly, I feel like in some ways I'm still learning that, but I'm like, good for you for putting all the shit down and just being like, "I'm taking care of myself." Good for you.
Yeah.
It's inspiring.
Yeah. Well, it's really hard. It's not natural for me to take
Right.
care of myself, but I have gotten a lot better at it. And I still meditate for 10 minutes every morning. Like it's like my first thing in the morning. I use Insight Timer. And I think that that's my way of sort of starting the day from a place of like, okay, I'm going to take care of me first, and then I'll take care of everyone else. But I have to be good first. And so I always
Yeah.
check in with
Yeah, yeah,
myself
yeah.
during my meditation. I'll do like a clear negative energy meditation if I'm, had an argument with my teenager, or I'll do meditation for energy. It sort of like repeats mantras. I'm safe. Just calms my nervous system down.
Nice, nice, nice. So, talk to us about, like, integrating this, into your work as a physical
Yeah.
therapist, like, as clearly this has been, like, life-changing for you.
Yeah.
Talk about that step of the process.
Yeah. So I thought at first I just started recommending curable to like all my patients because I was like,
Mhm.
I didn't know how to teach it to people. I was trying and I was getting better, but I didn't have the language until I took Dr. Schubiner class twice, and I also took a class with Dr. Schubiner and Charlie Merrill, who's a physical therapist out of Colorado. Have you heard of him?
Yeah. Yeah, 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 yeah. I've actually never, interfaced with him at all, but I follow him on Instagram, and I know who he is.
Instagram posts. Yeah, he is awesome. He is so awesome, and
Mm.
he basically saved me from like quitting physical therapy. um,
Wow, that's big. Okay, yeah, tell us that story.
So during Dr. Schubiner's first class, it was a virtual class, and so there was like 200 physicians and social workers, therapists, all these different people on the Zoom call.
I did the same class. I don't think we're in the same one, but I did the same
Yeah,
class. I know exactly what you're
yeah.
talking
So
about.
it was a lot, and I remember
It is.
it was on a Friday. It was partially Friday, and then partially on Saturday. It was like 4 hours, 4 hours, and and I remember thinking, after the class, I wonder if I can apply, so I was still gluten-free and dairy-free. I was like, "I wonder if I can p apply this neuroplasticity stuff to my food stuff?" And so we went out to a restaurant
Mhm,
that night, and I remember because we were at Polly's Island, and they brought the bread, and I'm like, "Okay, I can't eat the bread?" I was like, "I'm gonna eat this
mhm.
with joy, and it is not gonna upset my stomach, and I'm gonna feel so good tomorrow." I mean, I was, like, really, like, "I'm gonna really try this. I'm gonna get into it. It's fine. I don't have any fear around bread." And I ate that bread, and it was
Mhm.
amazing, and I felt great the next day. And so, the next day, I
I'm just relating so much. No, I have been in that exact situation because I was gluten free for forever during the bad IBS years.
yeah,
The number of times that I've been like, it's the bread that first comes out because, like, you don't even order it; it's just there, and I'm like, okay, I'm gonna do this. I've been exactly there, and have I been fine? Yes, I have.
right, right. Yeah, I now eat whatever I want, and it's wonderful, and I appreciate it all the time. But I remember saying to
Awesome.
Howard, I said, "I love this work," and I actually told him the story, like, on the with everyone, and I said, "It makes so much sense to me. It's like the missing puzzle piece that's been missing from my physical therapy brain, um, but I feel like it's negating my whole profession." And he said,
Right.
"Take a class with Charlie Merrill." And so I did. And Charlie has a beautiful way of weaving the mind and the body work together, because if we're working on someone's body, it's actually working on their brain. And
Yes.
he's a genius. He is a very, very wonderful person, extremely caring, humble, just like Dr. Schubner. I mean, they're both awesome. Um, that helped me to move forward and just use that in my practice. So, ever since then, use this stuff with every single client, and people find me from all over. Um, I've worked with people overseas, like people that just connect with my story. And I did a podcast on curable at that. But yeah, so
Awesome. Well, let me just butt in to say the way you say like this is negating my entire profession. That's really powerful. And then to hear that you were in that place of like you went to school for this, you've practiced this, you're licensed, and all this stuff. Like this is negating my entire profession. I hope other I just really hope other physical therapists like hear you when you say like, no, it's not.
yes.
Like that's really powerful. And could you go a little deeper with that? Like, this is something that I wanted to ask you. Well, okay. Is there more to the story, or are we ready
No,
for the
no,
next
no,
question?
no, I was yeah, go ahead.
All right, cool, cool. Because the next thing that I really think is so important is like talk to us for people listening, like talk to us about like your sense of the body, because even to hear like when you're like, oh, my headache starts, and I don't even know what you said, but I'm like, I don't know the body and anatomy like that.
Yeah,
So like, you have all this deep knowledge. Talk to us about your sense of the body and how it has how that sense has changed by doing mind body work.
yeah. It's so wild. I mean, I am a total anatomy nerd, like, in physical therapy school, when you do, like, the cadaver dissection, I mean, I remember what each muscle looks like, I love muscles and nerves. I'm just like, I can totally nerd out about the body and anatomy. Um, so
Awesome.
that being said, that's why this work is like, obviously we learned about the brain so much, but we never really learned about in physical therapy school about this at all. We never learned about the mind body connection, about just how the nervous system works and how it's just this top down effect. So, what I've learned over the years is it's so much more of the brain than the body. I mean, even if you acutely break your elbow, if you say to someone, it's okay, you're safe, you're going to the hospital, it's okay, that makes a huge difference in your pain recovery. Even afterwards, when you have all this fear and you're learning to walk with crutches or whatever you're doing, as long as your nervous system can feel safe, you're going to have an easier recovery. So you really can use this work like in every setting. Um, it's all what I've learned is just about the primitive nervous system feeling safe. And
Mhm.
it's not as much about issues in your tissues.
Mhm. Mhm. Right. Right.
I mean, I'm
Right.
used to just acting on like, if someone has low back pain, I treat their low back, I'm gonna work on their low back. I'm
Right.
gonna massage them. I'm gonna figure out, are these muscles tight? Are these muscles weak? And try to balance them out. But really, I don't do that anymore. I do use modalities to calm people's nervous system down, and I do use exercises. I don't think, exercise should be thrown out. I think that exercise is very
Mhm.
important, but
Mhm.
I always teach people about pain neuroscience first.
Yeah. Yeah. No, that's amazing. That's amazing. And I mean, I just think about in our field, like in the TMS and mind body world, I almost feel like we go the other direction because like of course there's so much focus on like something's wrong with your body, and our whole thing is like your body's probably fine. Like let's move on to the brain. And like that's so core to this message is like think psychologically, not physically. That said, treating the nervous system can totally be done through the body. So it's beautiful to hear you talk about that. I mean, can you give some examples for listeners so that they know? Like I did a podcast about that a while back, but I'm curious, from the perspective of a physical therapist, like what kinds of things do you know um, are known to help the nervous system, like body based treatments? You know what I mean?
Yeah, I mean, it's all about how you approach things. So, if you go into a massage or into physical therapy with like, this has to work. If this doesn't work, I'm screwed. You know, I'm putting all my eggs in this basket. They're going to heal me. That's not healthy. But it's
Right.
probably just going to be temporary. But if you go into PT or a massage or any kind of body work with, I'm just going to relax. I'm just going to calm my nervous system down. Say they get on a little tight spot on my low back. I'm going to say to myself, it's okay. It's just a little tightness. It's nothing dangerous. I'm just going to breathe and relax. Then that's a way to act on the nervous system.
Mhm.
If
Absolutely.
repeatedly, then it helps to rewire the neural circuits and then change your brain so that you can work yourself out of pain.
Mhm, mhm. Yeah, no, I'm feeling very, validated because that was I mean, that's exactly what I always think about that stuff,
Yeah.
is, like, it doesn't really matter, especially with the body-based stuff, it doesn't matter so much what you do, it's more about, like, how you do it and the energy you do it
Yeah,
with. Yeah,
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 exactly. Like,
yeah,
if you're out there running with fear of like, "Oh, I'm gonna run, but then my back's gonna hurt later. I don't think I have time to stretch," or if you're running with joy and you're like, "This feels really good to run. I'm strong, I'm healthy, I got this.
right,
I'm gonna be fine." My back might be a little bit tighter later, but it's okay. It's not a
right.
dangerous sensation. It's not a sign of a herniation, I'm
Mhm,
healthy. Then that's
mhm.
similar.
I hope everyone listening just took that in. Those are such nice positive messages to send to yourself when you're challenging yourself, like going for a run. Yeah, maybe that's really triggering. I get that.
Yeah,
Um, and these are the messages to send yourself.
right.
Thank you.
Right, and that's what I work with people a lot on is, like, activity modification and how to ease yourself back into things safely. It's a lot of self-talk. I'm sure you do the same thing. It's hard. I and we'll probably get to this, but, like, people need to talk to themselves, myself included, like you would to your best friend, you know?
Mhm. Yeah,
And I
yeah, yeah.
that is really hard for me.
Mhm. Well, yeah, so let's go there. Let's go through that door. I mean, you talk about yeah, it's like we're already sort of talking about this, but let's go there on a deeper level. Uh, this self-care, kindness to yourself, tuning into yourself. It's clear that that's been a big part of this for you as it definitely has been for me,
Right.
and it is for most people. Um, talk to us about that.
Yeah, I mean, it does not come naturally to me to, like, look in the mirror and say, "Katie, you're doing a great job today," you know? But I do
Same.
now. It's so cheesy, but I'll be, like, washing the dishes, I'll be like, "You know what, Katie, you're killing it today." And I am.
Yes, I was just gonna say, and you probably are. Nice. I love
I know.
that.
I do a million things
Good.
today, and I'm
Yes.
trying to recognize that and recognize the positive, and that's also part of me becoming an artist is, like, this is something that just makes me happy, and I'm just doing it. I'm not healing anyone. I'm not, you know maybe somebody's gonna enjoy my art, but I'm just doing it for me, and it feels really good.
I love to hear it. That's amazing.
Yeah.
Well, and talk about like because I mean, this has been so hard for me. I can tell it's so hard for you. It's hard for a lot of people. Talk to us about, like, how do you encourage your patients in this way, when you see people who are just like, like how you used to be, like, not kind to themselves, so hard on themselves.
Yeah.
What advice do you have for people in that space? Because I'm sure a lot of people listening to this podcast are in that space. And just for the listeners, you might not even know you're in that space. Like, when you're harsh on yourself, it's so normal to you. You might not even know the extent of it.
Exactly.
So, what advice do you have?
Yeah, I mean, I just tell people like, okay, so say I'm working with a man who's been through a lot of trauma. He's
Mhm.
had a horrible childhood, eventually became something of himself, but he's had this chronic pain for years. He can't figure it out. Um,
Yeah.
and I actually work with a lot of physicians in this position that have
Cool.
been through a lot of trauma and then have many
Yeah.
pain for many years. Um,
Yeah.
and I say to them, like, you know, what if your wife had been through this?
Yeah.
What if she had been through all this trauma and she'd been working so hard for years and years and she'd been trying to heal herself, she'd try to get better? What would you say to her?
Mhm.
Would you tell her like, "You suck. Why can't you get better?" No.
Mhm. Mhm.
"Honey, I'm so sorry. You've been through this. I'm so sorry. This is hard. This is a
Right.
lot." And
Right.
so we usually talk about it, but then I also do meditations with people and I'll encourage people to look at a version of themselves and I know Howard Schubiner has some of these on his website, where you sort of speak to your younger self,
Mhm,
and in a loving way,
mhm,
and I'll personalize it to whatever, like, situation they're going through, giving yourself a
mhm.
hug, telling yourself you're safe, and I think it's pretty effective.
That's awesome.
And
Yeah.
repeatedly, this isn't a one-time, one and done thing, as you know.
Mhm.
It's a work in
Yeah.
progress, you have to keep doing it, you have to keep coming back, and the more you do it, the better you get at it.
Yeah, absolutely. I love that. I'm thinking about, I know Nicole Sachs has a lot of teaching with about inner child work where she teaches like listening to your younger self.
Right.
And I really love incorporating both, like as your adult self, talk to your younger
Yeah,
self. As your adult self, listen to your younger self. Like do it all.
exactly. Yeah, we have a lot to learn from ourselves.
Definitely, definitely. And that's really well said because our we don't fully know ourselves. Like we're not everything that's going on is definitely not within our awareness. Like that is known for I don't know, centuries probably in fields of like mental health, psychotherapy. But it still bears repeating because I think we think like, oh, I know who I am. I'm with myself all day, every day. Like what more is there to find? But we are there's a lot that we are not aware of that is going on. So I love the way you say that, like, we have a lot to learn from ourselves.
Yeah,
Yes.
we do, and it's such hard work. It's so hard to really look at yourself in the mirror and be like, "I could do better. I can be better
Yeah.
to myself?"
Yeah.
It's hard to admit that.
Yeah, absolutely. I think it's hard to both be like, I, can do better being kind to myself, and it's also hard to let go, to let go of, like, what if I stop pushing myself so hard? What if I just, like, accept, like, this is what life is. This is who I am.
Yeah,
Like, I have to let go of the striving and pushing and shaping myself into someone I'm not. That has been very hard for me.
it's so hard. I know. I know. A lot of times it's harder for people to slow down than it is to speed up, which is certainly the case for me too.
Yeah, same, same. And I can't I have to point this out. I just wanna reflect the idea that, like, I just wanna, like, underline, like, the power of mind body work and the power of, like, what you and I know now and the way that we can help people, like, it is so profound to, like, know how to tune into the body and how to help people in that way. I mean, I'm just thinking about, like, how you said at the beginning of this interview, like, "I was gonna go to medical school, but, like, I realized, like, I'm too fragile for that." And we have, like, these false hierarchies,
Yeah.
like, as if being a doctor is like sort of the ultimate
Right.
healer, high status position. And here you are, the path you took. You have MDs coming to you because they need you to heal them. And so, you know what I mean? The idea that like maybe somebody could read this and like, oh, you're too fragile to be at the top of the field, but the people at the top of the field actually are coming to you because they need you. That's amazing. I mean, what do you think about that?
I don't know, Sean, that has never occurred to me before, but yeah, that's kind of full circle, isn't it? That's a good place to be in. I mean, I'm honored. Like anybody I get to help, I'm honored to help them. I feel like it's a privilege, you know,
Agreed, agreed. And I
other healthcare providers, because I feel like it has that trickle down effect where it's like, oh, I'm like, tell your patients about this, or, you may want to learn more. Here's how you can learn more. So,
absolutely. Yeah. No, I totally agree with that. Um, okay, let me ask you this. I mean, many people who listen to this podcast are looking for advice, and you're already giving us a lot of great advice, but, anything else that comes to you, like places that you see your patients get stuck, places you've gotten stuck, like any advice you have for people listening?
I mean, I think people get um, scared because they think, well, I have to go journal about myself for hours and hours, and I have to stare in the mirror, and I really have to look. This is really hard, but it doesn't take hours and hours of this work every day. You can do little things like, you're washing the dishes, and you're like, okay, I'm doing pretty good. I got a lot done
Mhm.
today. You just sort of little things, little self talk throughout the day. Um, And I think that's why this is so doable for everyone is just, you're sitting for a while and then you think, okay, my back's tight. And instead of thinking, uh-oh, when I stand up, it's going to spasm, it's going to really hurt, you just shift it and you say, no, it's just a little tightness. It's okay. It's no big deal. And I stand up, I'll be fine. And if I'll keep moving and I think so much of it comes down to self-talk, and it's not like you have to devote so much time. I mean, I know Nicole Sachs says 20 minutes of journaling and 10 minutes of meditation, which I think is great. But for me, I don't have that much time. I do 10 minutes of
Mhm,
meditation every day, but I also check in with myself a lot throughout the day. And I only journal
mhm,
as needed, which I don't really need to do that much anymore, which
mhm,
I don't enjoy journaling, but I love meditating.
mhm. Awesome, awesome. Well, and I relate to what you're saying about, I mean, the way that I teach about this is like there's like number 1, the psychological work, number 2, the emotional work, and number 3, attuning to yourself.
Yeah.
And yeah, I feel like there can be like a strictness, or people really fear the strictness of journaling,
Yeah.
or the strictness of like I have to do somatic tracking every day for a certain amount of time, and like I have to do it right, like I feel like people get really caught
Right.
in the same way
Yeah.
people are with meditation, like, you know what I mean?
Yeah.
And all of those tools are very helpful. I'm the opposite. I love journaling. Set me up with a journal for like an hour, and I'm like, perfect. It's like I'm all about it. Meditating. I don't meditate because I don't like it. But like that's important. Like if I like to journal, great. Then I need to journal. If you don't, then you don't need it.
Yeah.
If you okay. I mean, I guess some people are avoiding things by not journaling. So I guess if you're listening, take that with a grain of salt.
Right.
But you know what you're doing.
Yeah.
You don't need to journal, so you don't need to journal. You like meditating? Awesome. Then I think like listening to yourself, not with rigidity, but with like I'm saying this for people listening, like the tools are not the end. Like the end is feeling safe with your body,
Yeah.
feeling safe with your emotions, and feeling safe with yourself. Whatever gets you there is good. Whatever holds you back from that is bad, and we need to work on that.
Yes, I couldn't agree more. And everyone's different, so you know you the best. So that's what I tell people a lot, and then we just have to figure out the right puzzle piece to fit into your healing puzzle.
Yeah, absolutely, absolutely. I do. There's sometimes I fear people with that message kind of get. I mean, how many people maybe you relate to this in when you're like stuck in the medical model?
Mhm.
You have doctors like, we don't know what's going to help you, so let's try this, let's try that, let's try the other thing. So there's something that I feel like a little like um I don't know, almost it's like re-traumatizing people to be like, well, whatever, like maybe this, maybe that, but like I wonder what you think about this, because to me it's very clear that the message we're sending is different. It's like overall we know the general umbrella of emotional and psychological stuff that will help you,
Mhm.
that we feel confident about.
Yeah.
It's figuring out what underneath that umbrella is really gonna work. That's the way I see it. So it's very different than like, let's just try this pill or that pill, or we'll see how it affects you. But like, what do you think?
I mean, I completely agree. It's so difficult. You've had all these physicians tell you different things and create fear and I think it just goes back to your primitive nervous system feeling safe. Like what makes your primitive nervous system feel safe? That's going to help you heal,
Love that.
and for
I love that.
everyone is different. And and you can and I also want to tell people that you can use this on a lot of different things. I've treated people with a lot of different random conditions, and used it on myself a lot more, even just more than migraines. I mean,
Hmm.
I think I told you this before, but I had a doctor tell me in my 30s I needed bilateral hip replacements because
Oh wow.
my
You did say that though. Yes, right, right. Not, I'm glad you're saying this on the podcast. Yes, go on.
So, both I had, like, sciatica since I was pregnant, and I thought, well, I'd already recovered from this with my migraines, but I thought, well, I'm just gonna get my hips x-rayed and see, what it looks like because it was, like, oh, 12 years at the time or something.
Oh
And
wow.
I never thought this could be connected because it was very occasional, it wasn't a big deal. But he looked at my hips and was like, both your labrums are torn. It looks like you have like a floating bone over on your ASIS because you have so much arthritis in both hips. Like, and I only went for my right hip. He's like, how does your left hip feel? I'm like, it's fine. He was running 30 minutes late for the appointment. So I ran for 30 minutes. Like I felt great.
It's fine. Yeah, right. Like literally fine. Yeah. Like you're feeling
My
good.
glute would, sometimes feel really tight and kind of go down my leg. Um, And then so I left that appointment with so much fear, like, "What am I gonna do? This is terrible. My hips are so jacked up." He said, "Don't run anymore." He said, "Don't do the Peloton unless your knees are, like, externally your knees are sort of out and your hips are externally rotated." He's like,
Oh
"No."
God.
Just created so much fear for me, like, "I'll see you in a few years." I left
Oh God.
my CD of my hips,
Oh, gee. Right, right, right. And then how terrible they look and all the arthritis. Right.
so bad. So so then I thought after a couple weeks, I thought, "You know what, Katie? Nothing changed." So my hips hurt, uh, after that appointment, both hips hurt. Never had
God.
any left hip pain.
Wow.
Oh, it hurts.
Oh God. Isn't that awful? I hope people are listening to this and taking that in. Like, your left hip was good until you heard this
Yeah,
and all this fear
yeah,
came up. And also, I do want to highlight this because arthritis, I know is people like that's a gray area to some people in this world, but this is a clear example that your left hip was really healthy and felt fine, even though the x-ray showed like terrible arthritis. So I just want to underline that so people listening can hear that.
yeah.
But so what happened next?
Arthritis is normal aging. Yeah.
There we go.
Um,
There we go.
so after about a month of, like, pretty bad hip pain, I thought to myself, "Katie, nothing changed. Like you ran for 30 minutes before that appointment. You walked out of that appointment with hip pain. Like nothing changed about your hips. They're the same as they were before the appointment. The only thing that changed is my brain, is my fear."
Yeah.
And so
Yeah.
I really, really had to tap into that and I really had to think about it. I thought, you know what? He told me I had bilateral labral tears. He didn't do an MRI of my hips. You can't tell on an x-ray that you have labral tears. I'm like,
Oh, huh.
yeah.
I did not know that. Okay. Wow.
I mean,
Interesting. Okay.
I guess he's making an assumption, from the clinical exam that I had bilateral labor tears, and I don't think he was like I know I worked with his wife, like, he's a great person. Um,
Mhm. Sure.
he's
Yeah,
not
yeah.
trying to, like, get my
Ruin your life,
for
cause right, right,
this is
right.
his training, he means well, but, um,
Yeah.
so I thought, I'm gonna apply the principles of neuroplasticity to my hips, and I'm just gonna
Mhm.
use all these techniques that I used on my head now for my hips, and
Mhm.
you're fine. Like,
Beautiful.
you know, I can squat 300 some pounds, I can run,
Yeah, you can. That's awesome.
like,
Yeah.
I'm strong, I'm healthy, my hips feel
Yeah.
great, and I do notice
Good.
sometimes, them sort of, like, getting a little bit of soreness, but then I'll just check in with myself, and I'll be like, "What's going on? Am I doing too much? Am I overscheduling? Am I stressed out?" Could I be taking more time for myself? And then usually the answer is yes.
Right. Surprise, surprise.
But Charlie actually helped me, with that too, to really I never really got past my hip pain until I really let go of that fear that was created from that physician.
Wow. Yeah. Yeah, yeah. I mean, thank you for saying that 'cause, a couple, episodes back, we did a whole episode on medical trauma,
Yes.
and I just think it's really profound and kind of, like, under, appreciated. Like, I mean, what I said in that episode was that, I don't know if you ever did this, but Nicole Sachs and Christina Sarno-Horner have they have, like, a practitioner training
I have
called the Sarno-Sachs Solution. It was great.
yeah,
It was good. I'm in it if briefly at the end as a like I'm like a demo patient
yeah,
in the end. But I did the training for myself and Christina starts off from the beginning. One of the first things she says is like what you have to know when you're working with TMS clients is that like you're sitting across from someone who has gone through a lot of medical trauma and you have to be cognizant of that. And I was like Wow. Like that just hit me really hard because I'm like, that is true. And to hear this story where you're like that, I needed to acknowledge that myself.
Yeah. And one of the things that Howard does with patients is he apologizes for that medical trauma that they've been through. And so
Wow.
I've started doing that too. I'll just say, at one of the first sessions, I apologize on behalf of the medical community that you haven't gotten answers up until now, and nobody, you know, was out to get you. It's just, I'm just apologizing and on behalf of the medical community.
Yeah.
And I think people like,
That's powerful.
yeah,
Yeah, no, even just hearing you say that, I'm like, "Oh, thank you." That's really powerful. Has anyone ever broke down crying? Because I can imagine
God,
that.
John, people cry all the time. I have tissues in my office because, I mean, people are like, and people say, "You're more like my therapist than my physical therapist." I'm like, "I know, I'm
Nice.
sorry, but
Yeah, great. No, no, but that's the work that has to be done, so there's nothing to apologize for.
actually."
That's awesome. Um, okay, so before we wind down, let me ask you this. If you could just because I think this really helps people listening,
Yeah.
you're saying, like, there's many different conditions that you've worked with, that this is, with your patients, with you, and with yourself. If you could just, the first
List.
whatever comes to mind,
Yeah.
just give us a list so people get
Okay, how much time do you have? No, I'm just kidding.
it.
Um, okay, obviously headaches, neck pain, back pain, every joint, and these are all conditions that have this neuroplasticity stuff has helped. Just to prep.
Yes.
I've seen a lot of different things, but, um, you know, shoulders, like frozen shoulders, impingement, tendinitis in the really all over the body. I've seen, a lot of elbow different medial lateral epicondylitis. Um, Weird things like, one girl that had tingling on one side of her body, just an entire tingling on just one side of the body. She was better in one session. It
Wow.
was like some trauma that she had been through. Uh, peop
Clearly arthritis, I just wanna throw that out there for yourself. Yep.
Arthritis, yes. A lot of back pain, sciatica, knee pain, chronic ankle pain, like chronic ankle sprains,
Mm.
um, toe stuff like turf toe. Um, I'm just thinking through the body. Weird, hand sensations in your hands, um, prolonged withdrawal syndrome, after coming off of, like, opioids and benzos.
Mm.
Uh,
Mm.
I've helped people to come off of opioids before, like, that they
That's amazing.
IBS,
Yeah, that's huge. That's
anxiety.
amazing.
I mean, this work obviously helps anxiety, depression. I feel like I mean, chronic chest pain, like, more I think it's sort of muscular, like pecs. Um,
Mhm.
oh god, plantar fasciitis, yeah, a lot of
Mm.
yeah.
Mhm. Mhm.
I help myself with that too.
Yeah, yeah. Okay, great. That's so helpful. Thank you for sharing all that. And
No.
I'm sure there's more. And just to clarify, what you're saying is, like, these are not only conditions you have seen people suffer with who have come to you. It's also all of these are things that you're like, I have seen these things improve with this work.
Exactly,
Okay,
exactly.
beautiful,
Using
beautiful.
yes.
Okay, well, with that, let me just ask you this. Slip in this question. What if you say you were in front of a group of physical therapists
Mhm.
who were listening to you and they were really going to take in what you were going to say,
Yeah.
what's a message you would want physical therapists, people in your field to know?
Well, I would want other PTs to know that it's not our fault that we don't already know this. They're not teaching this
Yeah,
in PT school. So it's not,
yeah,
we have to do continuing education, but this is not a requirement for people to learn this. So not having this information is not your fault. Um,
yeah,
but you need to get this information because it's going to help your patients. And, I noticed that like before, my difference between treating people before and after is that I can usually treat people in less time with this kind of work. And so you
yeah,
think, well, it's not going to be very good for business, but there's so many people struggling with chronic pain that it all evens out. And ultimately, I believe most healthcare providers just want the best for people. Why else would you go into healthcare unless you just want to heal people and you just want everybody
Totally.
their best? So this is the work that can help people to live their best lives, like you said, authentically attuning to their patiently attuning to your authentic self.
Yeah, totally, totally. And I really I love that you say that because like most healthcare providers like are not in the business of like, ooh, yeah, how many surgeries can I milk out of this? Some hospitals honestly probably are, so that's kind of sick. But like the actual doctors, the actual certainly the therapists, the same, the physical, like the actual providers aren't like, how can I keep this person sick so that they need me, so that I get money off of them. Like we really, most of us, we want. It feels. I mean, I'll speak for myself, and I wonder what you think. It feels so nice to have someone say like, "This really helped me." Even like, "I don't need this anymore because I'm doing so much better. Thank you for saving my life." Like
No,
that's why we do this work.
exactly. That's like the most rewarding thing ever, ever.
Yeah,
It's the best.
yeah,
And I did
yeah.
just remember one other condition, TMJ,
Please,
TMD
thank you.
pain.
What is TMD?
TMD, it's actually TMJ, it's temporomandibular joint. It's actually the joint, but your TMD is temporomandibular dysfunction.
Oh, got it.
That's
Okay,
the actual
got it,
diagnosis, but it's basically
got it.
pain, but it's also can be
Good to know. So people are erroneously calling TMD TMJ.
yes, exactly.
Okay,
They're
good to know.
they're just talking about your joint. Everybody has TMJ because you have a joint.
Good to know. See, yeah, but I can tell you do like to nerd out about
I
anatomy.
really
I respect it. I respect it. Well, on that note, where can people find you if people want more information or they want to work with you? Where can people
So,
find you?
I'm not seeing people in person now in South Carolina. I am, just seeing people virtually. And then I also actually make videos for Curable. So if you're on Curable and you do a yoga video, you're doing my yoga videos. And then
I didn't know that. That's amazing. Wow,
yeah, it's
cool.
really fun. And then I actually work for a corporation called the After Cancer, which is a corporation that it's an app and it helps people once they've recovered from cancer and they're not quite where they want to be. This is an app that offers workout classes, which I teach, and mindfulness classes and cooking classes and stuff like that, just to kind of get to where you want to be. But my website is Queen City PYT. My and that's as in professional yoga therapy. I started it 10 years ago. I need to probably change it now, but what's the point? Uh,
Right. And you no longer live in the Queen City,
I know
right?
I'm not even in the so yeah, that to be determined.
But if people want to find you now, that's where they can find you.
Yeah, that's my
Queen
website,
City.
and then Instagram is Queen City PYT as well.
Awesome. Awesome. I don't know if I follow you on Instagram.
Yeah,
I will
I don't
start
know if I
doing
follow you
so.
either. I have to make
Oh, okay. Well, great. We'll have
really
to
bad
do
about
that.
posting on Instagram, to be honest. But and I want to say thank you, Sean. I mean, your podcast is so good. You're so vulnerable and honest and open, and I just think you're helping so many people. And I hope that a lot of people discover your podcast and get a lot out of it and work with you because you're incredible.
Thank you. I really appreciate that. That's really nice to hear you say that, and I receive that. Especially as we're talking about like, can you be kind to yourself? It's not often that I think to myself like, good job, you started a whole podcast, but
Yes,
um,
you're
yeah, I did. So so thank
you're
you.
killing it.
Thank you. That's right. Just like you are, when you're washing the dishes, you're killing it. I'm killing it too. Both of us, and probably everybody listening,
That's right.
we all need to give ourselves more credit.
We're all doing our best. We're
Right.
all good enough.
Beautiful. Thank you. We are all good enough. And on that note, thank you so much for coming on. Truly, this has been a really nice conversation. Thank you so much for offering this to the listeners and, helping people see into the nuances of like the body and connecting that to this work. Thank you so much. This is really helpful.
Happy to help, Sean. Thank you for having me.
Excellent. And for everybody listening, this has been Mind Body Medicine for Chronic Pain, and I will talk to you next week.